Welcome back to Morning Break, and this week's Monday Motivations is brought to you by Gates Brain Health. We all know Dr. Randall Gates, board-certified chiropractic neurologist and a chiropractic physician. So excited to be joining with you. This is the first time I get to chat with you. So
yeah,
I've heard some great things, and I'm very excited to talk to you about this topic in particular because a lot of attention has been put on concussions recently in local news or in just national news because of the Dolphins and Tao, their player. So we want to talk to you about post-concussion syndrome because you and I were chatting. Concussions are not just a one and done. There are lasting effects.
There can be, and estimates vary between 30% and 80% depending on your age of those who have a concussion. But they need to be taken very seriously. And sadly, what I see is that a lot of patients may go to the emergency room. They may get a CT scan, they may not. If the scan is normal, they're told, well, you should get better. And if you're not better, maybe you'll see a neurologist, get an MRI down the line. And lots of times those tests are normal, leaving people wondering why they're still having a lot of post-concussive symptoms.
So that's where that diagnosis comes in. So what exactly is post-concussion syndrome, and what are some of the signs to look for?
So post-concussion syndrome, it depends on the classification criteria you use. But in essence, it's symptoms that are prolonging past 3 weeks, a month, or 3 months. They can involve brain fog, mood changes, headaches, dizziness, as well as things like sleep disturbances, fatigue. There can be a number of symptoms, but that pretty well encompasses the main symptoms. The list is actually like 40 symptoms long.
My gosh, we do have a list of some of them on your screen right there. And you hadn't mentioned it, but how long do these symptoms really last?
Most of the time, they should only last for 10 to 14 days. But if they're prolonging past that time, particularly past 3 weeks, a month, I would really be paying attention and seeking more advanced care by someone who's very familiar with concussions, because the symptoms can prolong, and if you have another head injury within the time frame where you're still not fully recovered, the evidence shows that your chances of those symptoms becoming permanent are much higher.
And they kind of add on to each other too. It can just keep progressing and getting worse.
Right, absolutely. And that's the concern. For example, with the player that you mentioned, was there an injury that was maybe not dealt with appropriately, and then another injury happened within 4 days? And I think we all saw potentially the devastating consequences of that.
Heartbreaking video to see.
It's
just how the body reacts to it's just natural reaction to that trauma. So you mentioned that if people are having these symptoms, showing these signs, they need to seek other care. But what specifically can they do to help them?
Well, I think, I have like 10 YouTube videos. I have a playlist that may help in terms of education. I think knowing that there are advanced diagnostics that may not be getting to all the patients out there is really important. So on my last broadcast, you can see it on our YouTube page that I did with Katie, I talked about different imaging modalities that can actually tell you if there's damage to the brain. Now, most patients don't get exposed to that, but that is available for people to know that you can have microstructural damage in your brain that won't show up on your standard MRI, won't show up on your standard CT scan. And there are other tests. We do videotaped, recorded, quantified eye movement testing. That's really important. Cognitive testing can be important. So you have to put all these things together like a detective to say, okay, here's your post-concussive syndrome, and then this is why you're not getting better, because you have damage in XYZ area of your brain.
And we actually were chatting off camera. Football gets a lot of the attention because it's the poster child for brain injuries, but any sort of contact sports really has the risk for this.
I see people in motor vehicle accidents or collisions, skiing. Now we're heading into skiing season, soccer. Yeah, so many different activities, accidents around the house can result in this.
And is it, you mentioned at the start of this, depending on age. So are kids more susceptible to a post-concussion syndrome, or
they're
are
actually
adults
less susceptible because it's thought that their brain is still developing, so they have quote-unquote neuroplasticity that may help them to heal. So it's thought that kids might be a little more resilient than adults, but that's not to say that kids don't develop post-concussions.
And it's not to say you don't want to take the precautions.
100%.
Absolutely.
Yes.
And then I just want to ask you too, have there been any significant strides in, learning more about concussions and the post-care?
There have. Sadly, it doesn't seem like it's distilling down to all levels. I mean, I would say at a local level, I definitely see a lot of the local schools are really, they have a lot of initiatives. They're doing baseline cognitive testing for a lot of the athletes, so that is wonderful. I mean, it's definitely advanced, but then when we see something like what happened a few weeks ago on a national stage, that felt like a setback.
Certainly how that's hard. Dr. Gates, thank you so much for your knowledge. Really appreciate it today.
Yeah, thank you.
Thanks, Davis. We'll be right back.